hospital, and I've witnessed too many times how human rights of people living with HIV are neglected and violated, which made us really sad and angry, because we are people who decided to dedicate their lives to helping others. What we have seen is that they have been tested without being informed before. They were stigmatized, discriminated, in meaning of postponing or even denying care. Disappointed, we decided that we, as medical students who have big experience in delivering peer-based education on sexual and reproductive health and HIV/AIDS issues, should react to that. So we decided to focus on our colleagues, medical, nursery, and dentistry students, and also young physicians, in order to raise awareness, teach them on universal precautions, educate them, and build skills among them so that all people living with HIV can have equal access to healthcare without being stigmatized and discriminated against. We know that there are laws brought by governments that protect patients' rights. In the country that I come from, that law exists, but in real life, in hospitals, departments, the law doesn't quite work, because if I become a healthcare professional, which hopefully I will, I don't think that my colleague will report me for discriminating my patient, neither will my patient report me for discriminating him. So maybe trying to solve the problem, one of the approaches could be by changing behavior of healthcare professionals, by providing educational trainings in stigma and discrimination for medical, dentistry, and nursery students that will build future young physicians. And when I say future, I mean in 3, 4, 5 years, who will not stigmatize and discriminate people living with HIV. As a final outcome, we would have non-discriminative treatment of people living with HIV, and that way improve their life. To conclude, my Federation of Medical Students has 96 national member organizations worldwide, from Thailand across Ghana, Botswana to the United States. We count more than 1 million students who are actively involved in the work of Federation, and many of them in HIV/AIDS issue. So you could use us because we have a vision that medical students, as future healthcare professionals, could carry a much needed change regarding stigma and discrimination in healthcare services, as we will be the ones treating them. So do you think that this is something feasible, and do you think that we should continue working on this? Thank you very much.